Hi, my name is Maren Hein, and I was diagnosed with acute lymphocytic leukemia at age 3.
So, Maren was not feeling well for a couple of weeks in the summer, and took her to the doctor, and the first time we went to the doctor said, oh, we think she has just a virus. If she still has some of the same symptoms, which were a fever, she was pretty lethargic, she was tired all the time, bring her in a week. She was also having these spiking fevers right before she was taking a nap. We'd give her some ibuprofen, put her down for a nap, she'd wake up and not have a fever. So we thought everything was just going through this viral issue. And when we got to the room, the doctor was saying that this is something she had never had to diagnose before, but the blood test did not show that Maren had mono. It showed that she had cancer, most likely leukemia. I remember grabbing her and holding her into my arms and saying, this can't be happening, not my baby.
She ended up in the hospital for 10 days on that first visit. They did the full diagnosis. They began treatment within 3 to 4 hours of us arriving.
So, I started off the size of a normal 3-year-old kid, and then in a matter of 4 days, I gained probably about 10 pounds, and then in the next month, I gained a total of 20 pounds. I couldn't touch my toes.
Yeah, one of the things they did give us was a binder, and it told us what was going to happen every single day of the next 130 weeks. And you don't really realize they have this, it's broken down by week and by day, and you're going, it's this binder like this, it's a 1-inch binder, and we're thinking, oh, they have this all planned out, and then you're thinking 130 weeks. 130 weeks. That's over 2 years. That's 2.5 years. We're going to be doing this for 2.5 years. That was an awareness for me. I thought this was going to be something, 6 months, 9 months. But, the doctors, we had Dr. Casper, and then we had a PA and a fellow all working with us. And so I felt that they had a great team working with us. We had a social work. We felt that we could ask questions any time we wanted. We could talk to anybody. It seems like everybody, even though they didn't work directly with us, knew about us.
She kept her spirits, but she wasn't in good shape.
And with the steroids, you don't want to sleep as much, so she went from sleeping 4 to 5 hours a day when she was sick to sleeping 30 to 45 minutes a day, because steroids don't let you sleep very much. Something
else that happened, she had to take pills between her kind of every 3-week visit that were awful. And they tasted, she said they tasted like metal. They were just terrible. But she didn't know how to swallow pills, so we'd have to put it in pudding or do something else. And after about 2 months of that, she's like, I don't want to taste these anymore. I said, well, then swallow it. So she taught herself to swallow. She put her mouth. She said, oh, that's better.
Yeah.
And just she kind of adapted herself even at that young age to what she had to deal with. Yeah. About the last 6 months of treatment, so she's about 5.5 now. The chemo drugs started to have negative effects on her. She never lost her hair, but she started getting sick more frequently, and not leukemia sick, but just it wore down her defenses. So she had the flu 2 or 3 times. She actually had strep throat. We had our Make-A-Wish trip planned for like November, 3 months before treatment was supposed to be done, and we had to cancel it because she got pneumonia, and just was very sick off and on during that time, because after 2 years of chemo, your body just wears down. Early the next year, the doctors kind of consulted and talked to us and said, we think we're gonna stop the treatment early because we did all the tests and she was declared in remission with about, I think, probably 10 or 12 weeks before the end of it, just because they said at this point the drugs are probably doing more harm than good, because right now it's upper system. But they also warned us. They said it could come back tomorrow, it could come back in a year, and it could never come back. You just have to monitor. You know what some of the symptoms are now that you've kind of learned about it. You just have to watch her like a hawk to make sure. And the first year is the highest risk, but it could be 10 years down the road, it could be 15 years down the road. So Even though she's been perfectly healthy since then, it's just something you always have to keep in mind. Anytime she has a cough, anytime she's not feeling well.
I always say that it's like a little cloud. So when she first got leukemia, it was like a huge thunderstorm, rain, hail, sleet, all of those things. And then as you kind of move your way through it, then it lifts a little bit. It's still dark, it's still hazy, and there's times where it kind of comes in and wafts away. But you still start seeing some sunshine. And then once you're a year and a half into it and you're kind of used to the process of what's going on, you're like, okay, so we have to go on, your treatment again for another week, or a specific treatment, because she took 5 different types of chemo pills and shots and IV fluids at different times, because there's 3 different stages you go through with the leukemia. And once you're in that 3rd stage where you're just kind of warding it off, they bring the different medications in at different times just to kind of trick the leukemia cells so that they're not producing themselves.
The first time I went to One Step at a Time, the camp I now refer to as Cancer Camp, I was 7 years old. It was the first year I could go. And every year I've been going since, both summer and winter. And through camp I've met so many great people that prove to me that I don't have to be limited by my illness in life.
We're just very thankful that the leukemia she did get, and it sounds strange, but we're thankful of the kind of leukemia she got, because it's the most common, it's the most treatable, and has a 90% initial recovery rate. There were other kids in the hospital who had AML, which is a much more serious version, requires bone marrow transplants as a treatment, and has a much lower recovery rate. So even though things were bad, it was scary at first, and it was scary really through the whole process. We had faith in that the doctors knew exactly what to do. They told us what was going to happen, then it happened. Then they told us the next thing was going to happen, and it happened. And they told us it was going to be 130 weeks, and it was just under that. And exactly what was supposed to happen happened. So we were very fortunate. We were unfortunate with the diagnosis, very fortunate that followed the plan all along, and she's now a healthy, beautiful 17-year-old girl.